Hi, I am Dr. Rahul Bhargava, Principal Director of Hematology and Bone Marrow Transplant at Fortis Memorial Research Institute, Gurugram. So the biggest challenges in this country when it comes to blood cancer are the myths that the blood cancer is a death sentence. In 2021, blood cancer is no longer a death sentence. There are three biggest challenges when it comes to blood cancer. One, biggest thing is acceptability. Second is diagnosis. Third, affordable treatment. And all these things, on top of it, the fear of a chemotherapy, which directly transports you into an era of 1990, where you are afraid that the chemotherapy is going to make you sick. So let's start. So India is a very heterogeneous country and a very big country and a large country. So biggest problem is diagnosis. We are not being trained to think of blood cancers in our treatment textbooks because we always thought that we will not have blood cancers. That's one attitude which needs to change differently, and generation wise that has to take a shift because blood cancer can happen to anybody. So think about blood cancer, and the diagnostics are very, very simple by virtue of having a blood count called CBC, which needs to be read by a trained pathologist, which we lack in this country at this present moment of time. Once you are diagnosed, then the second problem comes of treatment. So where the treatment, again the biggest barrier is the will of a physician and the patient and the myths which are prevalent in the society for treatment, that the treatment is going to be super expensive, treatment is going to make you worse, and there is no proper treatment for blood cancer. So dear friends, in 2021 we have taken a great stride in treatment of blood cancers and we are living longer. Every day there's a new revolution which is taking place in the field of blood cancers, because we know that we are going to beat it, we are going to live with it, we are going to overcome it by virtue of new medications. So in 1990s, the medications were like a pan bomb, okay? Given, it kills everything and makes you sick. Of course, from a Hollywood and a Bollywood perspective, you would have seen, and that's what shapes us, isn't that? Comes 2021, the medications are smarter, they're oral, they doesn't lead to hair fall, they doesn't lead to nausea and vomiting. And moreover, the Indian generic drug makers has got 90% of drugs which are available in US at 1/10 the price is available with the same quality in India. Thus, ushering us into an era where we were surviving for 3 to 4 years in multiple myeloma, we are surviving for 8 to 10 years. In CML, where by virtue in 1990 and 2000 we were dying within 4 years, now only taking a pill, we are surviving for 20 to 25 years. And people are saying we can go up to 65 years of age if you're diagnosed at 35. So why are we afraid? AML, 60-70% people are now surviving past 60 years, post 60 years. You talk about lymphoma, 80% cure rates by virtue of spending not more than 2-3 lakh rupees in a 6 setting of chemotherapy. So huge strides have been made, and that's what the whole idea is, that we need to change our mindset towards blood cancer, and that's going to be the biggest hindrance for the right approach, because we still diagnose 80% of cancers at stage 4. What we require to come people early, like America, where 80% are being diagnosed at stage 1, we are still diagnosing 80% cancer in stage 4. So that's a gap which we need to fulfill. So we need to overcome these challenges of accessibility, affordability, right treatment, correct treatment, and affordable treatment. So for every cancer treatment, there has to be a diagnosis. When we say 80% of cancer being diagnosed at stage 4, it is not the problem of the people. It is also the problem of the healthcare not being able to provide them with the right diagnostics at their doorstep. And that's what the government of India is also doing by putting Ayushman Bharat, by putting wellness centers. But the important point, the revolution which needs to take place now is of a diagnostic revolution. And there are things which are happening. So we have digital transformations, digital health, which has been popularized by virtue of COVID-19, now has to transform into digital pathology, which means early diagnosis. So we have been able to put in the scanners like digital slide scanners, which gives you an early diagnosis. So simple example is, we have put in a slide scanner which can scan the peripheral blood slide. Peripheral blood is the gateway for blood cancer. So early diagnosis through a peripheral blood can lead to pickup of blood cancers faster, reliable, and accurately. So this has been put in Gorakhpur City Hospital, the first scanner, and every week we have been able to diagnose people entering with fever to their clinic. We have been able to pick up one cancer from that cohort. It means the more people go with a dengue fever to them, And because of the lack of having a trained pathologist, these scanners bridge that gap. And the idea is to put up 25 such scanners from a company called Sigtuple across the network of Uttar Pradesh and Bihar at district hospital, so as to confirm the diagnosis early. And once the diagnosis is confirmed early, either they can be treated by oral medication or they can be referred in time to the tertiary or quaternary hospital, so as to save the valuable time in which they go from various hospitals to hospitals without ever knowing that they are suffering from blood cancer. So digital transformation in terms of digital pathology, putting up scanners in terms of e-health is taking place, and we need to invest as well as escalate and evaluate these technologies so as to bridge the gap between the rural and the tertiary care hospitals, so that early diagnosis can lead to good treatment and better outcomes. So Ayushman Bharat has taken great strides. It has brought affordable healthcare to people around. And as we roam around into various Hindi hinterlands in the Uttar Pradesh and Bihar, cancer treatment has been transformed by virtue of Ayushman Bharat. And so is the treatment of blood cancers. But at the same time, the blood cancers, many newer medications have been left out in the space of Ayushman Bharat, like aplastic anemia as a treatment has been left out, because which is our problem, which is a problem of Uttar Pradesh, Bihar, Jharkhand, that every Sunday, every Friday, AIMS OPD, we used to see 300 odd aplastic anemia patients which are doomed to die because of lack of bone marrow transplants or ATG based injections. At the same time, the bone marrow transplant, which is considered as a curative part of a blood cancer, has been left out from Ayushman Bharat. So we request and we anticipate that in a newer policy making, the bone marrow transplants are going to become a part of Ayushman Bharat, because we know that bone marrow transplant transforms the life of a multiple myeloma patient. From 3 years, it increases the survival by another 4 years, which is 8 years. And it means in today, 2021, if you get a myeloma, and you are able to see the sunrise of 2029, I'm telling you, it's going to be way, way different from what you're going to have, because you have got newer technologies to cure them. The newer technologies today, what exists of 3 crore rupees might be of 30 lakhs or 3 lakhs in 2029. So more affordable. So you need to see the 2029 sunrise. Second, bone marrow transplant, when you talk about at this Institute of Blood Disorder, we have pioneered and we have seen how public-private partnerships can work in by establishing low-cost bone marrow transplants at Indore Medical College, Bikaner Medical College, Banaras Hindu University, ESI Medical College, Faridabad, because it brings in more affordability. A transplant which typically costs 5 to 6 lakh rupees in a private sector can be done free of cost at Madhya Pradesh in Indore Medical College, can be done at 1.5 lakh rupees in Banaras Hindu University, and that also money comes from a Prime Minister Relief Fund. So how the right technology along with the right talent needs to participate into this public-private partnership relationship, because we understand the human beings and the patients of this country, irrespective of state, irrespective of caste, creed and sex, they belong to a nation called India, and we need to serve, because we have been trained in this nation to serve the patients of this country irrespective of their socioeconomic status. So Ayushman Bharat actually needs to look in more about setting up such low-cost bone marrow transplant centers, so that even the person standing in the last mile gets the same treatment, same quality, same affordable treatment like any person in this country who owns, irrespective of their business status or financial status. So we wish that bone marrow transplants can be included Ayushman Bharat, and such low cost activities can be initiated at various medical colleges so as to transform the landscape of blood cancer, because we know that if given treatment properly, like in American state, 80% of people can survive. India needs more than 3,000 bone marrow transplants. In America, country of 33 million people, they do 33,000 transplants. 1.4 billion people, we do 3,000 transplants. So that gap is huge. We need to bridge it. Thank you.